Okay, so on the other hand, if you recall, we had two types of pathology related to red blood cells. So we had one type that was more anemia, which means that we had a decreased oxygen carrying capability in the blood. On the flip side of things, we have kind of the alternative pathology, which is going to be polycythemia. And so what happens here is that we actually have increased number of red blood cells. And what happens is it basically causes the blood to become thick. So we have an increased blood viscosity. And viscosity is resistance to flow. So if you think about water versus honey, you know, um, and in this case, honey would have an increased viscosity compared to water. So basically, increased resistance to flow. So what happens with this is we have increased red blood cells that basically cause the blood to become thick. And this is problematic because it's more likely to clot and basically clog up our smaller vessels. So not really a good thing. Some causes of polycythemia: polycythemia vera, which is cancer involving bone marrow, where the body is prompted to produce over amounts of red blood cells. Blood doping, which, if you're familiar with this, is basically athletes taking out blood before their event, and then right immediately before the event, putting that blood back into their body. So it not only increases blood volume, but it also increases the number of red blood cells, theoretically increasing the oxygen carrying capability of their bloodstream. So blood doping is illegal in most sporting events. High altitudes can lead to polycythemia because you have decreased atmospheric pressure at higher altitudes. So you still, in the atmosphere, there's always going to be 21% of oxygen. But what happens is that you've got decreased pressure, creating the pressure gradient, driving that oxygen from the atmosphere into the bloodstream. So what ends up happening is that in the blood, you're going to have decreased oxygen content. And we know that that's a stimulus for release of erythropoietin. So decreased oxygen content in the blood is going to increase erythropoietin release. That's going to stimulate the red bone marrow to increase red blood cell production. And then that ends up resulting in increased numbers of red blood cells. So typically what happens is when you have people who live at high altitudes, let's say like Colorado, we usually use that as an example, but any high altitude, they are going to have increased hematocrit or increased numbers of red blood cells because of living at that high altitude. And for them, it's normal. And as soon as they come back down and spend some time down at a regular altitude, their body will go back to a normal level of red blood cells. But living at that high altitude is a stimulant for increasing red blood cell production just because of that decreased oxygen content in the bloodstream. Okay, so lifespan of the red blood cells. So they do have a lifespan. So we're talking about 3 months. We typically say about 90 to 120 days is about how long they last because they have no nucleus, they do not replicate, therefore they live their life and then, they circulate for 3 months or so and then they start to break down. So old red blood cells become less flexible, they're not able to bend and fit through those smaller little capillaries, so they start to kind of break and fragment. And what happens is we have red blood cells recycled basically, and their parts are used again. So the spleen is kind of a hallmark of red blood cell, death, basically. It's like a graveyard for red blood cells. So what we see in the spleen, even the liver and bone marrow, is that macrophages in that area engulf the old red blood cells, and the hemoglobin is then broken down and separated into its component parts. So it's going to separate into heme, which is going to be then divided up into bilirubin, which is going to be eventually secreted in the feces as a byproduct. Iron is separated from that heme group, and now it's going to be stored for later use, and it's going to be released from the liver when we need it again to form new red blood cells, because we need iron in that process. The globin polypeptide chains are going to be broken down into their component amino acids and released back into the bloodstream and used as building blocks for other protein synthesis. So basically, we reuse as much of the components as possible. Okay, so second type, deformed elements. So if you, just by way of reminding you, we had blood, we could divide that into plasma, and then the other component was formed elements. And then under formed elements, we had red blood cells, which we've been talking about. Now we're on to white blood cells. So that's where we are now. So we're on leukocytes, which is the fancy word for white blood cells. And this is basically immune function. Okay, this is immune function and protection. That's what these guys do for us. So we've got two types of formed elements. So we can take white blood cells and divide them up. We've got granulocytes and we've got agranulocytes. Okay, so here's our granulocytes. So they're going to be granular, and you'll see that in just a minute. Granular, and we've got three types of granulocytes. So we've got neutrophils, eosinophils, and basophils. And then we've got agranulocytes. So these guys are agranular. So they have no granules in their cytoplasm, and you'll see that in just a minute. So two types of agranulocytes, lymphocytes and monocytes. And this little mnemonic, never let monkeys eat bananas, basically tells you in descending order the frequency of types of white blood cells in the bloodstream. So the most common type of white blood cell is going to be a neutrophil, and that's what the N stands for. Okay, so never. The L stands for lymphocyte. That's the second most common. M is monocyte. That's the third most common. E is eosinophils, fourth most common. And then the least common white blood cell is going to be basophil. Okay, so that's just a little mnemonic to help you remember them in order. In terms of granulocytes, in fact, all white blood cells, all tend to be larger than red blood cells. Okay, so these are big, more complicated looking cells. Granulocytes are granular. So they're going to have these dark staining granules in the cytoplasm. So you're going to be able to see that in the cytoplasm of them. And they're going to have lobed nuclei, which is basically, what you see here. Okay, three types of those. First type is going to be neutrophils. Okay, neutrophils. We also call them PMNs, and they stand for polymorphonuclear. Okay. P, that's supposed to be an M, M, N, okay? PMNs. So these guys are active with phagocytizing bacteria. They have multi-lobed nuclei, so their nuclei tend to have 3 to 6 lobes. They're going to have a lobe here, lobe here, lobe here, and they kind of stain like this purplish color. Typically what you see with neutrophils is that lab values, if you did a complete blood count with a white blood cell differential, you would see that specifically the neutrophils would be elevated when you have active bacterial infections like appendicitis or a meningitis. Okay? That's when you would see them react. Second type is going to be eosinophils. And these guys are important for killing parasites that we may ingest in our food. They also play a role in asthma and allergies. Eosinophils, their nuclei have two lobes, so you can kind of see one lobe here and another lobe here. Okay, so that's eosinophils. Basophils are these large, really dark, staining, almost black granules in their cytoplasm, and their granules are really, really, identifiable, like here and here and here. And the granules are going to contain histamine, which is an inflammatory chemical, as well as heparin, which is an anticoagulant. So these guys are important in the inflammatory response in tissues, as well as like in asthma and allergies. Okay, agranulocyte. So this is their second type of white blood cell. These guys are agranular, which means that they have no visible cytoplasmic granules. And we have two types here. So the first type is going to be lymphocytes. So lymphocytes are present in lymphoid tissues. We find these in lymph nodes and the spleen. So they're not quite as common circulating in the bloodstream. They tend to be more in the nodes or in the spleen, and then they get called out when needed. So they have this large, really round purple nucleus. It looks very smooth because it and the cytoplasm are agranular, so it looks a little smoother than the granulocytes. And we have two types of lymphocytes. We've got T lymphocytes and B lymphocytes, which are both active in creating the immune response in the body. Second type of agranulocyte are monocytes. And these guys, monocytes become macrophages. So I always tell people M and M. Monocytes become macrophages. So basically, the monocytes are circulating in the bloodstream. They can leave the bloodstream and migrate into tissue. And in tissue, they can phagocytize viruses and bacteria and parasites that they may come into contact with. So these guys are really large, and they have this U-shaped nucleus. So that's kind of their hallmark, U-shaped nucleus of monocytes, and they become macrophages. So some pathology related to leukocytes. First thing is leukemia. You may know someone who has leukemia. It's basically a cancer that results in an overproduction of abnormal white blood cells. So what you'll see is on a complete blood count, you'll see their white blood cell numbers will be through the roof, but they are not functional white blood cells. They are not normal and have difficulty fighting off infections. So even though the numbers are through the roof, they don't do a good job of fighting off infections. Therefore, these patients are at risk of death by infection. So you can name leukemia according to the cell type that's involved. It's either going to be acute or chronic, depending on whether it's arising from the stem cell or a later cell stage, which is what you'd see in chronic leukemia. And then it's named by the actual type of leukocyte that is involved. So acute lymphocytic leukemia involves specifically lymphocytes, that type of white blood cell. And then the second type is infectious mononucleosis, or mono. You may have had this or heard of someone else who has. This is caused by the Epstein-Barr virus, and this results in an overproduction of lymphocytes. And if you recall, lymphocytes reside in the lymph nodes and the spleen, which is why if you have mono, they're going to tell you to kind of take it easy. You shouldn't play any contact sports because your spleen gets enlarged and it could rupture and cause further damage. So they're going to tell you to lay low. Your lymph nodes might be really, really prominent and very painful as a result of this excessive production of lymphocytes. Okay, and now we're on to our third formed element, of platelets. So keep in mind, I always do this. I like to remind everybody kind of where we are. So under formed elements, we had red blood cells, white blood cells. We just finished those. And now we're on to platelets. Okay, so 3 options here. Platelets are kind of interesting. Platelets are not whole cells. Okay, so they are not cells. Red blood cells also not cells because mature red blood cells don't have a nucleus. The only one of these that are cells are white blood cells. Okay, so here we are, platelets. So these guys are not cells. So they're basically fragments of much larger cells called megakaryocytes. And so those large megakaryocytes will fragment into smaller pieces and end up forming platelets. So they're basically cell fragments that we see circulating in the blood. Again, as a reminder, all of these guys, all the formed elements, so red blood cells and white blood cells and platelets, or megakaryocytes that eventually form platelets, all come from the same hematopoietic stem cell, okay, in red bone marrow. So platelets, their function is to clot blood, right? Platelets, function is blood clotting. Okay, red blood cells, what was their function? Carry oxygen. White blood cells, their function was immune and protection. Okay, and so here we are with platelets, so blood clotting. Fancy word for blood clotting is hemostasis. So this is like stopping the bleeding after we've sustained a tear to the inside of the blood vessel or the endothelium. Okay, this is kind of interesting because this is an example of a positive feedback mechanism. And if you recall from before, most feedback mechanisms in the body are negative. So this is kind of unusual, okay, because it's positive. So there are 3 stages to hemostasis. The first is a vascular spasm. So what ends up happening is we have vasoconstriction of the smooth muscle in the blood vessel. So the smooth muscle is going to contract and decrease the diameter of that blood vessel because we have a tear and we want to minimize blood loss. Okay, so that's basically what this is doing. Minimize blood loss. So we're going to decrease blood flow to that area. The second stage is going to be forming a platelet plug. Okay, so when we have a tear in the endothelium of the blood vessel, it exposes these collagen fibers that are embedded in the lining of the blood vessel. As a result of that, the platelets are going to stick to that tear. And when platelets stick to the tear, it causes them to release chemicals that are going to attract other platelets to come and stick as well. Those additional platelets are then going to release their chemicals that attract other platelets to the area to come and stick. So here's our positive feedback loop, okay? And as a result, a kind of a sticky plug of platelets forms and it clogs up that tear. The third step is going to be coagulation. So the blood is going to change from a liquid to a gel, so it basically becomes thicker through a cascade of clotting factors. And so this is a whole process that we go through where blood goes from liquid to gel. We also have fibrin, which if you recall from before, these are going to be like protein threads that form a mesh, a fibrin mesh that allows red blood cells and platelets to stick to it, and this eventually forms the clot. Okay, and so this is it kind of all together. Again, this is really what's important here. This is an example of a positive feedback loop, which is a little unusual in the body. We have some disorders of the thrombocytes. Thrombocytes is the fancy word for platelets, so you should be familiar with that too. We can develop a thrombus, which is basically when a clot develops in an unbroken blood vessel. A few things can happen here. So here's like a clot within a blood vessel. It can block blood flow. That clot can actually detach from that blood vessel and travel to a distant site. And in that case, we call it an embolus. So it can either travel up to the brain and cause a stroke, or it can travel to the heart and cause a heart attack. One way to clean this out is through a catheter. And so what they'll do is if they identify an area where they've got a blood clot, maybe supplying vessels to the brain, they'll insert the catheter into the blood vessel and basically clean out that blood clot so that they can get blood flowing past it again. Thrombocytopenia is the disorder when you have decreased number of platelets. So if you have fewer platelets, then your ability to form clots is going to be decreased. We see this if you have a decrease in red bone marrow, maybe as a result of chemotherapy or radiation treatments. It may have that effect. This can be treated with a transfusion of platelets that will increase your platelet numbers back up to normal again.